Hello, Dr. Amanda Stevens here. I am here to answer your question about why would a baby see a chiropractor? And so this is a good question a lot of times that we'll get either from parents or that parents are getting from their parents or their friends when they mention that they're bringing their baby in to see a chiropractor. In our clinic, we see a lot of babies. Probably about half of my patient base is under the age of 1. So infant care is something that we care a lot about and that we're looking at, and it's going to be different for every case that comes in. So there's not just one reason why a baby would see a chiropractor. The most common reasons that we are seeing infants in our office, one is just to do a well baby musculoskeletal exam. We do a very, very thorough exam on our newborns, checking on their hips, checking on all of their ranges of motion, on reflexes, on their head shape, on their development, on their feeding. We do a very thorough exam to make sure that everything is going well, and that if there's anything that's not going well, we're catching it early so that we can intervene earlier, which usually means less intervention long term, which is good. One of the more common things, or some of the more common things that we do end up seeing or helping babes with when they're struggling with, are issues with motor development and movement, issues with infant feeding, and certain things like Torticollis and plagiocephaly. So plagiocephaly is when there's a funny head shape, or sometimes we'll have a flat spot on the back called brachycephaly. You don't have to worry about all the technical words, but when there's flat or funky head shapes, that's something that we can assess and guide through care, whether that's manual therapy with home care or sometimes just home care alone, which is great. Torticollis, same thing. When we have a restriction within the head movement of babe, usually we're seeing a tilt or a tilt and a rotation restriction. These are things that we can assess and make sure that there are no barriers to babe's function as they're moving and exploring through space in that first year, developing their movement patterns and learning how to interact with the world. These are really fun, really rewarding cases to work with, and every case is individual, so you definitely need your assessment before we know what is going to be required for you, but these are things we work with. When we talk about motor development, going through tummy time, rolling, sitting, crawling, again, we want to make sure that everything is easy and fun for babe. So if there's any physical restrictions that are barriers to those functions, we can alleviate those so that babe has more success. Or sometimes it might be just working with you and giving you some exercises, or talking about creating an environment that's going to help babe go through their motor development in an ideal way. And then when it comes to feeding issues, certainly we do have lots of experience in supporting technique, but we do not replace a lactation consultant or lactation professional, and genuinely prefer to work with those individuals, or in cases where we're both in contact there. But there are also lots of physical barriers or treatments that can help with feeding support as well. So if you've been in to see a lactation consultant, you've been working with technique pieces, or maybe they've even mentioned that there might be some physical tension or physical restriction that is influencing that infant's feeding success, that is something that we absolutely like to see sooner rather than later, because feeding is very important for our weight gain, all those fun things. So in a nutshell, as short as I can keep it, we work with infant feeding and motor development and movement, head tilts, head rotations, funky head shapes, and basically do everything that we can in educating you or alleviating barriers so that your babe can thrive from birth to walking. And if we nail it from birth to walking, then pretty much everything is damage control from there. We're just checking on you when you wipe out, which is also fun stuff we do later on. I hope you found this helpful, and have a wonderful day.